Hello everyone, my name is Katia Alonso and today's topic is going to be about mosaic effects of growth hormone in fibrous dysplasia of bone. Definition: Fibrous dysplasia and the McCool-Albright syndrome constitute a rare mosaic disorder caused by the somatic activating mutation of G-alpha-S. Characteristic manifestations including cafe au lait skin lesions, fibrous dysplasia of bone, and hyperfunctioning endocrinopathies occur in varying severity, depending on the embryonic stage at which the mutation occurred. Mutations early in embryogenesis result in multiple affected tissues, whereas later mutations result in more limited manifestations. Features: Typical features of growth hormone excess include corneocyphasis, cardiovascular disease, and overgrowth of the hands and feet. A classic radiographic finding is distal tufting of the phalanges. In patients with fibrous dysplasia and the McCool-Albright syndrome, these skeletal features of growth hormone excess are exaggerated.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1 2013 edition.
Page 566, Rapid Review. What is McCune-Albright syndrome? McCune-Albright syndrome is a genetic disorder of bones, skin pigmentation, and hormonal problems, along with premature puberty. What is the cause of McCune-Albright syndrome? McCune-Albright syndrome happens due to Mosaic G protein signaling mutation. What are all the clinical presentations observed in McCune-Albright syndrome? The clinical presentations of McCune-Albright syndrome includes cafe au lait spots, polyostotic fibrous dysplasia, precocious puberty, and multiple endocrine abnormalities. What is polyostotic fibrous dysplasia? Polyostotic fibrous dysplasia is a form of fibrous dysplasia which affects more than one bone, and fibrous dysplasia is a condition in which a normal bone is replaced with fibrous bone tissue. Define precocious puberty. Precocious puberty just means premature puberty, so it means the puberty occurs at an unusually early age.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high-quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.
Application in medicine. The effects of growth hormone on skeletal metabolism are complex. The exogenous administration of growth hormone are associated with increased bone remodeling. The mechanism is unknown but may be related to increased proliferation of bone marrow stromal cells, Impaired differentiation of the cells is a primary effect of the activation of G-alpha S, driving the formation and expansion of fibrous dysplasia lesions. This highlights the importance of the diagnosis of growth hormone excess and its treatment in patients with McCune-Albright syndrome.
Liam is a 5-year-old, and he has a rare bone disorder called fibrous dysplasia. It forms fibrotic tumors throughout his bones. He also has a second condition called rickets, so it makes his healthy bones very prone to fracture.
When I first met Liam, he was about 18 months old. He was not walking, not feeling well, and now he is a different kid.
IBJI is in the forefront of treating bone disease and fractures. If we hadn't gone to IBJI, he would have either not healed correctly or been in a lot of discomfort for quite a long time.
The fun part about doing pediatric orthopedics is I get to see them grow. And for someone like Liam, where the diagnosis was unknown initially, to watch him go through the process, he's doing great.
Pros and cons. The pros are that treatment with binophosphanates is usually effective at relieving pain, but the cons are the bone pain in the absence of a fracture is more common in adults but can also be present in children.
Hello, viewers. The topic is fibrous dysplasia. The fibrous dysplasia is a bone disease that destroys and replaces the normal bone with the fibrous bone tissue, and one or more bones can be affected. Fibrous dysplasia occur in childhood, usually between the age of 3 and 15, and this condition is linked to a problem with the gene mutation that control the bone producing cells. The mutation occurs when a baby is developing in the womb, and the condition is not passed from parent to child. So this is not inherited. The symptoms of this disease may include like bone pain or bone sores or lesions, difficulty in walking, endocrine gland problems, or fractures or the bone deformities. But this is rare, and unusual skin color, which is the pigmentation, which occurs with McCune-Albright syndrome, and the bone lesions may stop when the child reaches the puberty, and your doctor will perform a physical examination, and x-rays of bone and other imaging tests are also taken just to have a closer look, there is no cure for the fibrous dysplasia, and bone fractures or the deformities are treated as they need it, and hormone problems will need to be treated as well. The outlook depends on the severity of the condition and the symptoms that occur, and depending on the bones that are affected, health problems that may result include like if the skull is affected, there can be vision or hearing loss, and if the bone is affected, or the leg bone is affected, and there can be difficulty in walking or the joint problems such as arthritis. And there is no known way to prevent fibrous dysplasia, and the treatment aims to prevent complications such as recurrent bone fractures to help make the condition less severe. The alternative names used for this condition are like inflammatory fibrous hyperplasia and idiopathic fibrous hyperplasia. Thank you very much for watching this video. If you need more information, you can visit our website www.diseaseandtreatment.com. And please do not forget to subscribe this channel for more informative videos every day. Thank you and goodbye.
Issue applied in Ecuador. The worldwide incidence is unknown, but a frequency of 1 case per 100,000 to 1 case per million inhabitants is estimated. This entity is classically composed of polycystic fibrotic dysplasia, cafe-au-lait spots, and endocrine disorders, and the main one is precocious puberty that can develop with a precocious menarche. However, other endocrinopathies can be associated. There is no racial, geographical, ethnic, or gender predilection. Conclusion. The mosaic nature of fibrous dysplasia and the McCune-Albright syndrome leading to overgrown is one hand shows the hypersensitivity of fibrous dysplasia of bone to excess growth hormone as compared with unaffected bone. Thank you so much for watching.